Now I'd like to ask Dr. Robert Sarr to spend some time addressing the committee on the role of the great outdoors and health.
Thank you for having me here today. It's an honor to give some testimony about a program that is very dear to my heart. I'm a pediatrician right here in the district. I practice 5 days a week. Continue to do that as I also parallel that work being the National Park Prescription Advisor to the National Park Service. So I'm here to talk about ParkRx, which is actually Park Prescription, and in a way that I hope will illustrate some of the points that were mentioned earlier. And my comments really are going to be in the context of how we can combat this epidemic of chronic disease through nature. Next slide. So before I get into what ParkRx is and how it fits into this big picture here, I think I'd be remiss if I didn't take some time to talk about this chronic disease epidemic. 1 in 3 Americans is currently suffering from at least one or more chronic disease right now. This is the modern day scourge. We sit, we rarely go outside. Between 87 to 95% of our time, both awake and asleep, is spent indoors. These are things like high blood pressure, diabetes, overweight, a slew of mental health problems from depression, anxiety, ADHD, on and on. These are the things that are actually causing us to suffer and to die prematurely. Next slide. If you want to know numbers, here are the numbers. So millions are suffering from serious mental illness, millions suffering from obesity, millions suffering from diabetes, high blood pressure. And if you're interested in saving dollars, and you mentioned that earlier, healthcare expenditures is a great way to save money. So right now we're spending about $3.2 trillion on healthcare expenditures. And about 86% of that dollar is actually spent on managing chronic disease. Now, I'm a pediatrician, and you'd be surprised what I do every day. Yes, I do the common colds and the vaccines and all that, but on top of that, it's in the context of chronic disease. Kids now have prediabetes. I see kids on a daily basis with A1C levels of 7%, 5.9%. So it is now a reality. We're not talking the next 5, 10 years. It is happening now. Next slide. This slide is actually not here as a breather, although you may see it as that. This slide actually has a real effect on you. It lowers your cortisol, it lowers your pulse, it might even lower your blood pressure. Next slide. And so this segues into the mental health effects, right? We know that looking at nature or being in nature doesn't necessarily mean being active in nature, which is a good thing too, but literally just being in nature or looking at nature, it decreases your anxiety, decreases your negative thoughts. It actually, in children, there's a great study out of UIL with Dr. Francis Kuo, two groups of kids, both with ADHD, attention deficit hyperactivity disorder. One group got Ritalin, one group did not. One group got unstructured play in a natural setting. Well, when I grew up, we didn't call it that, but you just went outside and played. And it turned out that 6 hours later, right, which is sort of 4 to 6 hours later, which is the maximum effect of Ritalin or a stimulant medication, they looked at the symptoms of both groups, and guess who fared better? The group of kids who actually went outdoors. I'm not suggesting we stop giving our kids Ritalin. I'm suggesting that we think a little bit about how our kids spend their day. If they talk at a turn, if they move out of their seat, they're told, go see your pediatrician and get some Ritalin. And I'm not exaggerating, this happens every day. Next slide. It's not just about mental health. You know, we know that it has an effect, as I mentioned earlier, on reducing your cortisol levels. So there are forest bathing groups in Japan, buses of Japanese who are taken to the forest, and they monitor their cortisol levels. Cortisol is a stress hormone. It goes down. They monitor blood pressure. It goes down. We know that people who live close to a park or near a park, have access to a park, have less anxiety. We know they have less chance of developing type 2 diabetes. We know that overall mortality is reduced simply by being in or near nature. And back to the money figure here, there was a study in 2004 in Nebraska that actually measured cost savings, which is kind of interesting here. So for every dollar spent on building and maintaining bicycle and pedestrian trails, you save $3 on healthcare expenditures. Next slide. So I'm almost at ParkRx. I want to talk a little bit about Healthy Park, Healthy People, which is a program out of the National Park Service. There's actually an Office of Public Health within the National Park Service that is there for very good, obvious reasons. And Healthy Park, Healthy People has sort of 5 areas to it, one of which is creating partnerships. And that's where Park Rx or Park Prescription falls. Partnerships between parks, partnerships between land and water agencies, and the health provider world. This isn't about just doctors. You can think broadly: psychiatrists, podiatrists, therapists, on and on, people who are providing care. If I wince, by the way, it's because I have a ruptured Baker's cyst in my right knee, and I just saw a physical therapist about 2 hours ago. So even physical therapists prescribe time in outdoor settings for their patients, and I talked about that with her as she worked on my knee. Next slide. So we all know that if you have a national website, you've made it. You're real. You exist. Okay? I'm just a joke. We actually do have a national website. It went live about 2 months ago. And if you want to see more information about Park Rx, there's a brilliant, I think, list of resources there to help you understand all the programs around the country we have already, and what it means, why it's relevant to the health provider community, and why it's easy to use. Next slide. So I'm going to dive into an area I know best, which is DC Park Rx, which I have founded and been directing for the last almost 6 years now. And it's simply a community health initiative whose goal is to promote well-being, wellness, prevent and treat chronic disease. Wow, that's huge, right? That's a lot we're trying to do here. But remember, we have a national epidemic, and it really spans the spectrum of all the kinds of disease, mental and otherwise, that we are suffering from. Next slide. I didn't do it alone. A lot of partners involved, both local and nationally. Next slide. What have we done so far? We've mapped and we've rated the green space in DC. We are now adding parks in our regional counties, in Montgomery County and Prince George's County. We'll reach Arlington, Fairfax very soon. So we're building this database of parks that then we take, make it electronic, and we link it to the electronic health record. We went live in July 1st of 2013. It's now not just where I work, which is Unity Healthcare. Now we have CCI, which is a federally qualified health center in Southern Maryland. We have Children's National Medical Center involved in this, also prescribing. So when you add it all up, this is now not just a DC thing, but it's a regional thing. Soon I hope to be a Mid-Atlantic thing. Soon I hope to be a national thing, where we are literally prescribing nature to a region that contains about 200,000 patients and about 300 providers. It's a pretty substantial group now. Next slide. So usually I talk to some doctors as well in the crowd. I think I'm probably one of the few here today. Woe is me. 3 clicks away. When you're in my world, if it's not easy to use in the electronic health record, you're not going to use it. So 3 clicks I've got it down to in where I work at Unity Healthcare. It's down to 1 click, actually, at the other 2 large provider groups. They literally just type in .parkrx, and it links up. So let's go 1, 2, 3 on those slides. This is what it would look like if you're inside my patient's electronic health record. Very quickly, let's go through these. Another one, and there you are. So 1, 2, 3, you're now inside the database. You put in a zip code, a landmark, an address, and then you press search, and you get parks down there. I can't read it from here because I'm getting a little bit older now, but usually it's about 20 or 30 parks on the bottom right-hand corner. Next slide. But that's not enough, right? We found out that you have to be able to match the park, the best park or the best 2 parks to the person, in this case, your patient. And so we can filter it now. And when you filter it, let's say if somebody wants to play, and this isn't just for kids anymore, by the way, this is for everyone. We all need to be outside more, and kids need to see good behavior modeled by their parents and grandparents and family, etc. So we do this all ages, all specialties, in many places around the country, and certainly here in our region. And you can match it to activities. Let's say they want to play baseball, basketball, golf. There's actually a park here in DC. We can go horseback riding, whatever it is that suits your fancy, for whatever time is suitable for you, in your schedule, and your willingness to do it. And then next slide, there you go, voila. You have a park page. A park page is a summary of a park. We have now 354 parks and adding to our park database. So you can imagine this incredible resource that's in general underutilized because of our daily routines of not being outside. And the patient can then either be texted this eventually, emailed this, printed, and have this as a tool as part of the prescription for them to actually go outside and use a park, but in the form of a prescription. So I would never tell you, you know what, Senator, I'm sorry, you have a pneumonia, and I want you to go to the pharmacy, take the antibiotic, whatever antibiotic you like to take it as long as you want, with or without food, and I'll see you whenever. I don't do that. So, and no one really does that. So we're doing the same thing with parks now. We have specificity. We want to make sure that it's a tool people can use, it's relevant to their practice, and it's specific. And now we have done all of those three things. Next slide. So next steps, this is my last slide. So I would challenge everybody in this room to think about ways in which we can expand this nationally. We're doing it regionally already. But how do we do this nationally? Where do we think about this from a public health perspective? Where are the most vulnerable populations who need the most to use parks? Now we know people living in low-income families, people of color, are the least likely to use green space. Oh, and by the way, they're the most likely to suffer from premature mortality and chronic disease. So it's really, the onus is on us for a number of reasons. But certainly, I would posit that we could probably save billions of dollars when we do the analysis in healthcare expenditures by simply connecting our patients to parks. The second is we need to use technology. You know, I'm not a Luddite. I'm actually a sort of a technophile. I carry my phone like everybody else. When I first started practicing 15 years ago, I thought, and I only see low income, that nobody was going to have one of these in the office. I was the only one who didn't have one. I was a late adopter, and that's true. The data shows that actually the low income were the fastest users and adopters of this technology. So my patients actually have these smartphones, and they use them. The question is, how do we use this technology to help us both prevent and treat chronic disease by prescribing parks? And we're working on that now. And then the third thing is we can never forget to think about evaluating and researching the work that we do. At the end of the day, we need to know that the science truly supports this. I need to know whether my patients' blood pressures and A1Cs and BMIs actually improve over time. And we are also thinking about that locally and nationally. Thank you.
Thank you very much.